Your teenage child has been diagnosed with functional neurological disorder, short for FND, and have you or your child experienced this thing called medical gaslighting? In today's video, I'm going to talk about 11 common medical gaslighting phrases that you and or your child may be hearing from doctors who give a diagnosis of FND. Hi, my name is Dr. Jean Lee. I am a pediatric psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again. Because I truly believe every teen deserves so much more in their lives. If you're new to this channel, welcome, and make sure to click the link below to get the free PDF parenting guide on how to help your teens at home who's struggling with chronic pain or FND. So in today's video, I'm going to talk about medical gaslighting and 11 common medical gaslighting phrases that doctors may be saying, mostly unintentionally, but yet very invalidating to the teens. So really quick, what is FND? FND is the second most common diagnosis you would get in the neurology clinics, right next to headaches and migraines, but nobody knows about it and nobody talks about it. That is because it is an umbrella term to describe the cross-wired problems between the brain and the body when physically, quote unquote, you look fine. It is a legit condition, it's a neurological condition, and your kids are not making things up. And it is not just one problem that is causing, it is multifactorial, and therefore it's called a biopsychosocial phenomenon. And I have tons of videos talking about what it is and what are those factors, so make sure to check those videos as well. So let's talk about what is medical gaslighting. So essentially, medical gaslighting is any comments or phrases that makes teens doubt their experiences or thoughts. And generally speaking, the medical gaslighting is said by providers or doctors or anyone in the medical setting unintentionally. However, it's very, very invalidating, as I mentioned. Medical gaslighting essentially minimizes teens' symptoms, and doctors are basically insisting that the condition as what they see and belief based on limited experience or exposure to teen FND. So as a result, what happens is that doctors don't really look anything further. So that includes medical diagnostic evaluations like lab works and imagings and other testing and things like that. Or they may just straight up fire you by saying something like, well, it is what it is. There's nothing I can do. I don't know anything about this, so good luck. So let's talk about 11 common medical gaslighting phrases. Number 1, oh, it's your anxiety. Number 2, oh, it's stress. Sometimes combination of, oh, it is called stress anxiety. Number 3, oh, it's purely psychological. So you have to go see a psychologist because it is all mental. It really undermines our work as a psychologist, just so you know. And it's a very blood-boiling moment as a provider myself. But moving on, number 4, it's not real. What your child is having, it's not real. Oh yeah, it is very real. Number 5, oh yeah, we need to have this conversation. Your child is making things up. She's faking. Who would like to fake this kind of conditions? No, they're not faking. Number 6, it's all in your head. It is all in your head. Therefore, you have to go see a counselor. This is not the place for you to be in. Very invalidating and straight up cruel. Number 7, great news. All the tests are negative. There is absolutely nothing wrong with you. It's almost like that you're drowning in the water and the only thing that we can see is your hand kind of like drowning. And then the doctor's kind of giving you a high five while you're drowning. Very invalidating. But I hear this a lot. Number 8, oh, it's a teenager problem. No, it's not. Number 9, oh, it's a hormonal problem. Well, hormonal issues might be related, but it's not really a hormonal problem per se. It's a lot more complicated than that. Number 10, don't worry. This is going to go away all on its own. Just wait for 6 months or maybe a year. It's going to go away all on its own. So you don't have to do anything. Not true. In fact, the sooner you start the treatment, higher prognosis. So do not wait. It's not necessarily going to go away on its own. Sometimes it might, but if you don't have the tools to handle and reduce the symptoms, then 2/3 of the time, the spontaneous recovery can happen, but it can also come back. So it doesn't necessarily go away on its own. Lastly, not the very least, I hear this a lot too. Yep, this is called functional neurological disorder, and you are going to live with this condition for the rest of your life. So there's no cure for it, so you kind of have to learn how to live with it. That's not really true either. FND symptom itself is very much treatable, manageable, if not solvable with the right approach. There isn't any one-size-fits-all treatment, but there are definitely ways for you to get better. So what can you do after hearing these invalidating, gaslighting statements? Well, other than you feeling upset, which you have absolutely right to feel that way, I would like to emphasize teens' voices matter. Therefore, I would like you and your teen to be assertive and ask clarifying questions. Things like, can you explain to me how you got this diagnosis? What do you know about it? And how is this different from other diagnoses? How did you get to this conclusion that I have this diagnosis? Be assertive, and you have the right to know what's up, okay? And just because you got FND diagnosis doesn't mean that it's doom and gloom. Maintain hope as much as possible, because there is a hope. I've treated so many teens with chronic pain and FND, and they do get better. Just because you got gaslighting doesn't necessarily mean that your experience is not valid. It is real, it is legit. And on that note, as much as possible, find an FND specialist that you can work with. There are not that many, but there are some out there for sure. And when it comes to finding a provider who is an FND specialist, generally it's parents' responsibility. However, teens do have the right to know who they are and then what they can do to help them, and you as a parent as well. So make sure to ask these questions. Hey, I found you on whatever the list, and I'm curious if you treat FND, and if so, how is your treatment approach? Ask those questions. And also ask, what is my role in it as a parent when you work with my child who's been diagnosed with FND? Because the treatment of FND is very much the active team approach. Therefore, you as a parent are the vital part of the treatment. So I'm hoping that whoever you work with can give you the guidance and coaching on what you can do to help your child at home or any other situations. FND is a legit condition for sure, and your kids are not faking. As much as these gaslighting phrases are very invalidating, that doesn't necessarily mean that your experience is not important. Your experience is very important, and keep up the hope and be assertive and ask questions. You can even say, hey, I don't really like hearing that kind of statement. So what did you mean by that? You can always ask those questions. I would love to know what your medical gaslighting experience has been in the comments below, and I would love to interact with you. And on that note, if you and your bright teenage child are ready to take step-by-step actionable solutions, then you might be a good fit for my program. Click the link below to schedule a call to talk to me directly and see if you qualify for my program that is specifically tailored for teens who struggle with chronic pain and FND. Thank you so much for watching this video, and I will see you in the next video.